Hi, my name is Jennifer, and I'm one of the inpatient transplant coordinators at Rush University Transplant Program. I'm going to talk to you about some of the things you should know when you receive your transplant. The kidney transplant surgery usually takes about 4 to 6 hours, and a kidney pancreas transplant takes around 6 to 8 hours. The donor kidney is placed in your lower abdomen on either the right or left side. Your kidneys or pancreas are not usually removed during the transplant surgery. After surgery, you will go to the intensive care unit for at least a day of close monitoring. When your medical condition is stabilized, you will be transferred to the transplant unit where you will stay on average 2 to 3 days. You may stay longer after a kidney pancreas transplant. There are many things you must learn to take care of yourself after transplant and to prevent organ rejection. Rejection is what happens when your body's immune system attacks the new organ. Rejection can happen at any time, even many years after your transplant. The medications that you take to prevent rejection are called immunosuppressants or anti-rejection medications. Having an organ transplant is a lifelong commitment. The medications you are taking must be taken every day as directed by your healthcare team. If you stop taking the anti-rejection medications or even miss a dose here and there, you risk losing your transplanted organ. It's important to keep track when you are running low on any of your medications and make sure you get them refilled to avoid situations where you will run out. If you are having any issues obtaining your medications, you should call the office as soon as possible and ask for assistance. Further details on transplant medications can be found in your transplant handbook. Keeping your follow-up appointments is another important thing you must do to prevent rejection. Blood tests will be done at your appointments to help detect rejection and other problems. There are signs that we want you to watch for kidney rejection. These include decrease in urine output, fever greater than 100 degrees, gaining more than 5 pounds overnight, bloody urine, pain over the incision site, and increased blood pressure. Pancreas rejection may be identified with changes in lab values or pain. If you experience any of these issues, please let us know immediately. If a kidney or pancreas rejection is suspected, a biopsy will be done. The treatment plan will depend on the biopsy or test results. There are also signs of infection that we need you to watch for. If you experience any of these issues, please let us know. A fever greater than 100 degrees, pain, burning, or frequency with urination, fluid leaking at the incision site, increased heart rate above 120 beats per minute, difficulty breathing, or changes in blood sugar. If an infection is suspected, labs and other tests may be done based on your symptoms. These tests will help us give you the right treatment for the infection. There are some simple things you can do to prevent infections. These include washing your hands frequently, showering, not sharing food or drinks with others, washing fruits and vegetables, cooking meats thoroughly, and last but not least, taking your medications as directed and keeping your follow-up appointments. We wish you the best after transplant, and we are here to work with you toward a successful outcome.